So let us begin with Nash therapeutics study streak for today, and the remedy that we will discuss is aurum metallicum. And if you are in this video till the end, it's not a long video, then you will understand why do people fail by adopting a particular method and failing with just one remedy coming again and again, which is belladonna. And you know the method and the reason why the same remedy keeps coming in all the cases. So it's good learning from you if you are there till the end. If you are not there till the end, then quite unfortunate that you are going to be disillusioned by lot of methods and lot of teachings, and perhaps your eyes will open after many failures or dissatisfaction of the patient. It's your choice. So let us take up Nash therapeutic study streak, and the remedy that we'll discuss is aurum metallicum. Now, the first line, what Dr. Nash tells us, is very interesting, and we all know about it. And in fact, everything that is there in Dr. Nash therapeutics is all what we know about it. But the only reason is that we don't open our eyes is because we don't see the other perspective and we are seeing it from one perspective only. So you learn something interesting if you're there till the end, and it's going to be a good journey with just one remedy today, which is aurum metallicum. Looks on the dark side, weeps, prays, thinks she is not fit for the world, longs for death, strong inclination to commit suicide. Now this is a kind of picture perfect scenario for aurum metallicum. And a man strives for getting this metal, this ornament. He wants to earn, he wants to show off, and the very same metal becomes the cause of suffering or great unhappiness. So very interesting. This is what Dr. Nash writes. And then he tells us that there is deepest despair, gloom, life is a burden, and the patient desires death. Suicide dwells constantly on his mind. Now, if you study the thematic remedies, thematic ways of prescription, you will understand that this state comes after a long phase of doing some duty or responsibly acting for the family, work, or society. And if you know this aspect of the patient, then you will understand how he represents in the later stages. The patient may or may not come to you in the end stage when there is actually a thought of suicide or the feelings that he is overburdened. He will come to you even before that phase, and that phase will be of responsibility and duty. Your job is to understand the patient in the duty conscious or strong responsibility conscious phase. And it takes time for us to understand when the patient shows that aura of aurum metallicum. It's difficult, but once you try to understand the different aura of different remedies, it can be by behaviors, it can be by certain emphasis that they lay on words, sentences, or emotions, all these things, how deeply you are moved by his story, what is your feeling, all these also contribute to the physician's choice of the remedy. So, aurum metallicum, Dr. Nash tells, this is the picture: despair, gloom, burden, desires, death, suicide dwells constantly. In men, he tells us that In men, this condition is often connected with liver troubles. In women, this condition is connected with womb troubles. And in both the conditions, there are repeated attacks of congestions to the parts and then it ends in hypertrophy. So you will see many patients they come to you with fatty liver or even deeper stages of liver troubles. Or in women, fibroids are common. So if there have been repeated attacks on that organ for a long time at periodic intervals, just like we saw in the remedy Sodainum yesterday, repeated attacks of some outbreaks of eruptions. This is what we read in Sorainum yesterday. Similarly, if the deeper organs have repeated attacks of congestions to the parts, and then ultimately the patient is coming to you with hypertrophy of that part or organ, gives you good grounds for prescribing aurum metallicum on the physical level if you try to pick this up from the patient's history. And the same thing you will see is there in the head, heart, kidneys, or the chest. Aurum metallicum is a very peevish and vehement remedy, kind of you can say stubborn. Least contradiction or least condition excites his wrath or anger. Now you will see that we have been in a routine ways prescribing Nux vomica to such patients, those who get least offended or Staphylococcus aureus. But if you want to give natrum muriaticum or rather understand natrum muriaticum, you will need to understand his position in his family and his status in his society. Then probably you will reach much closer to the aurum metallicum state rather than just giving nux vomica, staphylococcus aureus and palliating the case. So Dr. Nash tells us that Aurum metallicum is very much close to Naja and Nux vomica in least contradiction which aggravates. We'll have to differentiate based upon the physical troubles and the place where the patient actually is in the current life situation. Next, he gives a case of a lady who tried to commit suicide and how she got well with aurum metallicum. And then Dr. Nash gives us the description of the bone affections which are of syphilitic origin, especially if the long bones are affected, and he gives a comparison with fluoric acid and angustura to give in such caries or destruction of bones. Now, we will not be able to see the actual caries of the bones, but what we will be seeing is a kind of a destructive process. You can say it is osteomyelitis, or you can say in the MRI spine of the patients, we will see some destruction has happened. It can be the disc has got very thinner, or there has been what do you say kind of a the nerve ends, the nerve sheets, the bony destruction or the fusion of the bones has happened. Sacro uh, lumbosacral sacral bones are fused kind of. So you will see all these things in the reports, and that will point you to syphilitic traits, and you will be able to prescribe either aurum metallicum, fluoric acid, or angustura. He also tells that aurum metallicum is mostly acting well on nasal palate and the mastoid bones, and there is a kind of a routine catarrh and then the caries of the bones. And then he tells us how aurum metallicum is good in restoring the vision. For example, aurum metallicum sees only the lower part and not the upper part. So when you get cases of cataract, when you get cases of eye troubles, ophthalmic cases, you should ask a bit more about the exact vision related symptoms and go down in the repertory or the materia and find out which remedies will fulfill this condition. You will reach much closer to the simillimum than getting lost in the story of the patient. I can vouch for this based upon my experience of treating lots of such ophthalmic cases. So lycopodium and lithium carb can see the left half of the object, whereas aurum metallicum will see the lower half of the object. And last but not the least, Dr. Nash tells us that there is indurations in the womb in women, and in men you will see induration of testicles. Fatty heart with much vascular disturbance, and by fatty heart you can say that he meant to say atherosclerosis, or kind of a fatty deposition in the arteries of the heart. So you will not see fatty heart per se in any of the investigations that come to you, but you will be seeing more of atherosclerotic changes, which definitely point to fatty heart, which Dr. Nash tells us. So you have to relate the words which the authors of old time have mentioned with the current scenario investigations which you see. Otherwise, you will forever get lost in the story of the patient and you will never be able to come out. And the symptom which Dr. Nash tells us: violent palpitation with anxiety and congestion of the chest, visible beating of the carotids and temporal arteries. Now, there is a differentiation which Dr. Nash gives, and those who are here till the end, you will understand what is important in each case. You will adopt a particular method, you will give a remedy, and the remedy which comes commonly in certain method is belladonna. Belladonna may relieve the attack, but aurum goes deeper. This is what Dr. Nash tells you. Now, I'll give you an example. When you give a patient a remedy based upon whatever rubric or the material you choose by referring those books, you will feel that this is probably the most optimum medicine from your analysis. But you have to understand the sphere of action of the remedy. You have to understand how deeper the medicine will go, how deeper belladonna will go, how deeper aconite will go, what is the disturbance in the patient, is it of psoric, syphilitic, psychotic nature, tubercular nature. And that is what Dr. Nash writes: belladonna may relieve the attack, but aurum goes deeper. Once you understand this and look at every case in a different perspective by analyzing it from the sphere of action, from the disease point of view, from the symptoms which the patient is complaining, subjective, objective, clinical examination, you will prescribe more better remedies than just belladonna which comes through single method. So try to open your vision of practice, and horizon of homeopathy is very large. This is how you should take each case individually and in a fresh light, rather than just falling back in the same pattern of giving one remedy again and again. So we come to an end where Dr. Nash tells us that aurum metallicum is a remedy which is good for bone pains. It ranks on par with Kali iode, asafoetida, and Merksol in periosteal affections. So that's all from me right now, and I hope you are following the channel Homeo Setu on WhatsApp, Instagram, and Facebook, YouTube, everywhere. You will be updated with certain interesting learnings all the next 10 months of 2025 and furthermore also. So that's all from me right now. Thank you for joining.